Welcome everybody, and I would like you to be part of this endeavor which I have undertaken to make sure that different difficult wounds and difficult problems faced by diabetic patients and others are addressed in a very novel and modern way. I am Dr. Narayana Murthy, a plastic surgeon. I am popularly also known as VBN. I've been in the city for the last 25 years, having trained in plastic surgery, and with a special interest and passion to deal with the different kinds of wounds. Wound is something which all of us sort of have encountered at some point of our life. Even as a child, when you fell down, you would have had grace in both the knees, which you will not forget, with the amount of pain all of us have at some time experienced. The nature of the wounds have changed. The body has now encountered a lot of changes because of the lifestyle. Diabetes and chronic diseases have become very common. Advances in medicine have made sure that we live longer, and also a lot of medicines are given to treat various cancers and other conditions which inherently cause depression of the process of wound healing. So what you may ask are the recent things which a common man has to know about. Okay, let us look at a fall by a young boy, and with all his normal health and vitality, the wound heals in a predictable manner, and is happy to go about his normal life. And as I said before, the modern stresses of life has thrown out new diseases or new lifestyle changes like diabetes and other causes, and people who have had chronic diseases are also treated with medications which depress wound healing. So in these patients, when they have a minor wound, the wound does not heal in a normal expected manner, and therefore it is very important that these wounds are taken care of right from the day they occur by somebody who has got a widespread knowledge of the management of wounds, and also a passion and has the understanding of all the modern methodologies and techniques and instruments which can heal these wounds. It goes without saying that a very good clinical management of these patients with medication, control of diabetes, and appropriate surgery at the appropriate time goes hand in hand with the proper management of the wounds. What I'm going to do today is to introduce you to another modality called hyperbaric oxygen chamber or hyperbaric oxygen therapy, which is not new but has now come to be um, almost easily available and also affordable to some extent, so that this new treatment can be instituted for a lot of conditions. So what you may ask is the need for oxygen when oxygen is available. Oxygen available in the normal air is only about 23 to 25%, and it is available as 1 atmospheric pressure. What the wound needs is the maximum amount of oxygen. Next to the brain, or almost as equal to or more than the brain, the healing wound requires a lot of oxygen. And conditions which prevail and which will prevent a proper oxygenation of the wound will naturally cause delayed wound healing or less than appropriate or less than expected wounds. So hyperbaric oxygen chamber was initially used for people who have had what is called bends or difficulty in these people when they come out of deep oceans on divers. And the same chamber is now used to deliver a large amount of oxygen to the places where it is most required, especially the wounds. So we have a chamber at this new facility here, where the most modern, the sophisticated, and most importantly the safest machine available in the world will provide you this required oxygen to the wounds where it is most needed. Diabetic wounds, the feet, are one of the common causes of amputation, and hyperbaric oxygen therapy instituted for these people will actually prevent amputation in some cases, and more importantly hasten the wound healing in difficult cases. There are a list of lot of other conditions where hyperbaric oxygen has come to be known as a gold standard in the management. People who have had chemotherapy, cancer treatment, radiation, surgeries, multiple operations, and wounds which do not heal for a long time are crying for oxygen. And hyperbaric oxygen, or HBOT as is commonly called, will be a boon for these patients. The required amount of oxygen will be delivered to these wounds when these patients go inside the chamber. We shall show you in a small clip how the chamber works and what the patient experience inside the chamber. But I can assure you that it's an experience which most patients have really benefited. So HPOT, or hyperbaric oxygen chamber treatment, is a new modality of treatment which can be given for a wide variety of conditions in the body. Snake bites, other bites, severe infections, especially what are called anaerobic infections and necrotizing fasciitis. They do extremely well when they are treated with hyperbaric oxygen therapy. Now coming to the other aspect of hyperbaric oxygen therapy, where oxygen is needed even for normal people. It has been known that with the modern stresses of life and pollution and air pollution, the adequacy of oxygen in the air and also toxins do build up in our body. So this is also a new treatment, or this is also a new condition where patients or normal people can come and avail this facility of hyperbaric oxygen therapy so that they can detoxify the body of so many other chemicals. So HPOT has successfully been treated for what is called wellness. As part of your wellness therapy, where you detoxify yourself with various other alternative medical treatment, consider HPOT as an adjunct or a very useful adjunct, so that this can help you to achieve a goal of wellness in patients. One of the things which I notice patients tell me is that the condition of the skin improves immediately and drastically, and most of the women are extremely happy that an exposure to hyperbaric oxygen improves the quality of the skin, and sometimes they do mention this as a glowing skin. This is a adjunct or a side effect, or let's say a very welcoming side effect, which I find is welcome in all these people who use hyperbaric oxygen therapy. Hyperbaric oxygen therapy is also useful in conditions where patients have anemia. Anemia will cause decreased oxygen carrying in the blood, and as you know that the organs require enhanced oxygen or normal oxygen, hyperbaric oxygen therapy for severe anemic patients will not only cure or help symptomatically anemia, but also try to reverse the damages, the end organs sometimes, which these end organ damage which these things can produce. So HPOT is a treatment of choice for also anemia. We have also had patients who have told us that their severe bleeding following uterine bleeding has stopped after a course of hyperbaric oxygen, and this was a real pleasure to watch in patients as well as for the doctor. We did go around and look to the evidence in the literature, and we found to our surprise that this can treat anemia and bleeding in these women. Let me take this opportunity to welcome you all to have an experience of this wonderful new technology, which I can promise you is the latest and the best, and most importantly, I can assure you that this is the safest HPOT machine available in this part of the world. I would also really assure you that your experience will be something which will be unique, not only as a patient but also for yourself as a normal human person, to enhance the wellness of yourself. So welcome to HPOT chamber and all the best. Thank you.